We're very excited about the DermAid Foundation. It's a way for volunteers around the world to submit photo consults to a dermatologist here in the United States. It's raised awareness and it saves lives. I'm Dr. Chris Schock. In this tutorial, we'll talk about therapeutic options for the very common reactivation of chickenpox known as herpes zoster, also known as shingles. So let's delve into the therapeutic options for herpes zoster. Again, it's also known as shingles, and it presents as a localized, painful, blistery rash. It does not cross the midline of the body. Well, if you have zoster, it's important to initiate early therapy. There are oral and intravenous or IV antivirals. Usually oral antivirals are treatment enough. There are a few cases where zoster may involve the ear or the eye, where intravenous or IV antivirals are recommended. Ocular involvement or disseminated zoster, what that means is you have shingles or zoster and you're immune suppressed, and the rash isn't just confined to one region, it can spread over much of the body, kind of like chickenpox. That may require hospitalization because of the potential for internal involvement. Again, early therapy is important because it decreases the severity of the condition, and it also decreases the chance of developing what's called post-herpetic neuralgia, which is persistent shingles pain. That can last for months or in some cases years. Well, what are we going to do about it? Well, antivirals. There are three main antivirals that we use. One is called acyclovir, one is valacyclovir, and one is famciclovir. Usually treatments last for about 7 to 10 days, and these can all be taken orally. Prednisone in certain cases is recommended, but that's really only for cases where there is severe pain or where the eye is involved or if the ear is involved, then prednisone is recommended. We think it might decrease some of the damage to the nerves in those very sensitive areas. Pain control is important because this can be excruciatingly painful in some cases. Sometimes oral narcotics are used to control the pain. Sometimes simply non-steroidal anti-inflammatories like ibuprofen or Tylenol can also be used. There are some pain modulating drugs such as gabapentin, pregabalin, or amitriptyline that can be used. These modulate the way our brains perceive the pain, and they're good for more long-term pain control in post-herpetic neuralgia. Zoster prevention. Well, there is a vaccine known as Zostavax. It's a live attenuated virus. So that means it's the varicella virus, but it's a weakened form. The CDC recommends that all people age 60 and over receive the Zostavax to prevent zoster. It's not given if you're on immune suppressives such as prednisone, cyclosporin, or anti-inflammatory drugs known as biologics. So if you're going to be placed on one of these drugs, your doctor may want to give you the Zostavax prior to initiating therapy on immune suppressive therapies. The Zostavax reduces your risk of developing shingles or herpes zoster by about 70%.
The people that we work with, some of the people are so isolated that we have one chance.
With each dime we raise, we can offer more free skin cancer screenings, more free aid internationally, more free aid in your own state.